Greetings from Washington, D.C. This is Peter Thomas, the General Counsel of the NAAOP. There's a tremendous amount taking place in Washington and wanted to bring you up to date on not only health reform efforts generally, but impact on orthotics and prosthetics specifically. First, the general issues. The Senate was not able to agree in the month of September on an ACA repeal and replace measure and did not bring a bill to the floor for a vote. It was fairly contentious. There were 180 people, mostly people with disabilities and wheelchairs, arrested in the Senate Dirksen building during a hearing on the bill. And clearly there were many organizations who lined up against the legislation. Ultimately, this means that people with prosthetic orthotic needs who currently have coverage under the Affordable Care Act and who have coverage by virtue of the fact that O&P is generally considered an essential health benefit will continue to have coverage in the not too distant future. They will ultimately retain those benefits and not lose them as a result of a repeal and replace measure. That doesn't mean that HHS cannot implement regulations that allow states to have certain flexibility with respect to some of the ACA protections, but it certainly is a major step forward that the program will move forward as is, and both Medicaid recipients and people in the private insurance market, the individual market in particular, will continue to have coverage of orthotics and prosthetics for the foreseeable future. Second, the children's health insurance legislation is making its way through both the House and the Senate. That covers about 9 million children, and of course covers O&P Care, and that's other good news that we wanted to bring you. Unfortunately, there's some specific news involving orthotics and prosthetics that is quite disappointing, and there's no hiding the fact. The BIPA Section 427 law that passed 17 years ago in 2000, and that we've been trying hard for the past many years to get CMS to regulate. A proposed rule for which was issued in January this year, comments for which were due in March, unfortunately has been withdrawn. CMS published an announcement in the Federal Register that essentially stated that they were withdrawing the rule so that they could continue to work on this issue without being hampered by what the rule had said in the proposal. So let's go back and figure out what this means. First off, for those who may not know, BIPA Section 427 is the provision in federal law that currently exists, it's just never been fully implemented, that ties the billing privileges for Medicare, the right to bill Medicare, for custom orthotics and prosthetics with the qualifications of the practitioner or supplier. We have viewed this as very important to implement over the years, have been very frustrated that it has not been fully implemented as of yet, and now we're particularly frustrated that it appears that we're taking a step backwards instead of forward. There were many mistakes along the way. First off, I must tell you that the statute itself exempts physicians and qualified OTs and PTs from BIPA Section 427, and yet CMS published a proposed rule that would have covered physicians and PTs and OTs. That engendered tremendous backlash from those communities, and those are powerful organizations. In the end, the O&P message simply was eclipsed by many of the folks who felt that the O&P field was doing everything they could to protect their own ability to provide orthotics and prosthetics, in particular custom O&P care. And unfortunately, that message did not go over well within HHS. I should also say that we always knew from the beginning of the Trump administration that this regulation faced a stiff headwind, because the Trump administration's goal in healthcare in particular is to reduce regulatory burdens on providers. And this was viewed as a way to reduce that regulatory burden and grant some relief to physicians and other providers. We need to understand, though, that number one, the announcement did entail a statement about how they plan to continue working on this issue with stakeholders. We've already made contact with CMS. We plan on going in to meet with them and we'll be working on other alternative ways to try to accomplish our goal. Second, there is legislation in the Senate and the House, the O&P Medicare Improvement Act, that would essentially compel CMS to finally issue these regs. We need to get that law passed, and that's more important than ever at this point. By the way, that legislation exempts physicians, PTs, and OTs, and really targets the real purpose of the rule, which is to ensure that qualified practitioners and suppliers, excluding DME suppliers or pharmacies or other providers with no real education or training in orthotics and prosthetics, are the ones who are able to build a Medicare program for O&P Care, custom O&P Care. So we will live to fight another day, and we will continue to work with Congress and the administration to do all we can to implement and finally implement BIPA 427 and finally get a connection between the qualifications of the provider and the right to build a Medicare program. Thank you.